Hi, this is Sarah Berga. I'm the Medical Director of OBGYN and Women's Health Program Development at Oshai Children's Hospital in Kaleida Health, and also Professor and Chair of the Department of Obstetrics and Gynecology at Jacobs School of Medicine. And it's my pleasure to join you today to talk about vaccination during pregnancy and answer any questions that you might have. So here are my disclosures. And our learning objectives today really are pretty straightforward. We're going to talk about how the vaccination for COVID-19 plays a role in infertility and fertility concerns, its benefits for pregnant women and lactating women, and the importance of making sure family members are vaccinated as well. So the bottom line is pretty straightforward. Vaccination is safer for all aspects of reproductive function than getting a COVID-19 infection. And now we have the data to back up what we thought was this before, but we didn't have all the data. So the new data are even more reassuring, and we now know that women and men seeking to conceive and those undergoing infertility care definitely should get vaccinated to protect their fertility. And women who are currently pregnant definitely should get vaccinated to protect themselves and the pregnancy. And women who are currently lactating should get vaccinated, no reason not to, and maybe some benefits associated with vaccination during lactation for baby. And as many family members as are eligible should get vaccinated so that we really create a sanctuary in the home for our babies, children, and adults. So let's just talk about eggs and sperm and miscarriage and fertility. There's several new studies that came out over the last 3 months that are highly reassuring. And there was one that just came out recently in August that the CDC released showing that vaccination does not increase the risk of miscarriage. And in fact, not getting vaccinated and getting COVID-19 might well cause preterm delivery and may actually delay fertility or compromise outcome from fertility interventions. And so the good news is that if you recover from COVID-19, it's not going to affect eggs and sperm, but it will affect sperm and sperm quantity for about 90 days after an infection. We are not really sure how long the infection affects eggs, and that is a little harder to investigate. But what we know now is that getting an infection during when you're trying to conceive actually slows the brain message to the eggs and the testes and causes underproduction. So the vaccination doesn't interfere with any aspects of fertility, so it's clearly better to get vaccinated. So what is vaccination? There's a lot of science out there, and I think that sometimes it's even hard to explain to other doctors. So I think it's more important to think about it as immune education. And we do this a lot. If you talk to someone a couple generations older, they remember the polio pandemic and the misery that caused worldwide. We immunized young children for a reason, because we know that it's important to get them vaccinated. And there really is a gap, I think, in our thinking about this, because this vaccination really is no different than the other vaccinations. And we have rules and regulations for when to vaccinate, and we have that here. But now we have really a very safe form of vaccination that is as safe as any other vaccination we've ever had. And as some people will say, because it's so worldwide right now, more people have been vaccinated with this COVID-19 vaccine than any other type of vaccination in the world. So the risks are markedly reduced. They're not zero. You still need to do all the other things, but it really provides the kind of immunity that protects even against the Delta variant. So just to reiterate the fertility. So our big organization that safeguards fertility in the United States is the American Society for Reproductive Medicine, and they've been putting out every few months guidance for those of us who are infertility experts. And this is the original guidance in December 16, 2020. So as things were really gearing up last winter. And they said the following: COVID-19 mRNA vaccines are not live virus and are not thought to increase the risk of infertility, first or second trimester loss, stillbirth, or congenital anomalies. So these are all things that sound awful and we wouldn't want to have them happen. And people said, well, where are the data? Well, the data have emerged. So all those statements are now true. It is safe to try to conceive or undergo. Is it safe to try to conceive or undergo infertility treatment during or after vaccination? Yes. It is better to get vaccinated before the infertility interventions if you can, so you're not sick for a day or two. But if you don't get vaccinated, and here we are watching a rise in Delta, that may well compromise or delay your fertility. And this is both men and women. So as I mentioned before, I'm showing this little yellow arrow pointing at GnRH and another yellow arrow pointing at LH and FSH. Those are the brain message and the pituitary messages that drive ovulation. So off to the side is a picture of ovulation. It takes 2 weeks of that brain message to actually stimulate and cause the release of an egg. So if any time during that 2-week time there's a decrement in that brain message, then the egg doesn't do what it's supposed to do. And that's the same concept for men for spermatogenesis. Anytime that brain message is compromised, then you get a problem with fertility. So this is actually a study that just came out in July, again, showing that after vaccination, on average, men had an increase in sperm counts. So some of this might have been seasonal, but it's clearly showing in this waterfall plot here that there is no decrement after vaccination. So if you do get COVID-19 and you're a man, how long would your fertility be compromised? It looks like, based on case reports and a large study done below, that there's a decrease in sperm and sperm motility, i.e. their ability to fertilize, for 72 to 90 days. So why take the risk? The updated guidance released from the same organization in July shows the following. COVID-19 vaccines do not reach or cross the placenta, induce antibodies against the placenta, do not increase the risk of miscarriage or compromise male or female fertility, and do not compromise the outcome of fertility treatment outcomes. I've gotten a lot of questions about this, and I really think it's important to be reassuring. If you want the chapter and verse, I just wanted to show this. You don't have to read it, but it's got all the citations. And there are many citations for each of the statements that was in synopsis, the slide before. So let's talk about pregnancy, a really special opportunity to be vaccinated by mom. This was guidance that came out from basically the CDC. It's called MMWR. It's a newsletter that they put out. It's a publication that's very widely read throughout the world because it's short and succinct, and it's an easy-to-read format. So they said, what's already known about this topic? And this is now talking about vaccination rates in pregnancy in the time frame March to May of this year. And at that time, we knew that pregnant women were at increased risk for severe illness and death. And when they did this database search, they found out using the Vaccine Safety Data Link that only 16% of women in the United States had received one dose or more of the COVID-19 vaccination. So this was alarming, and I think basically we were waiting for the data to say it's really, really safe to get vaccinated in pregnancy. We knew it was safe, but now we started to really worry that it was really unsafe not to get vaccinated. And so this led to this pronouncement in August that really we needed to do a better job about vaccinating pregnant moms. And here you can see the uptake starting in March and then ending in May. And by that point, this is actually 20%. Very few groups have been vaccinated at even the 20% rate. So how bad is it? Well, this is a slide that really is alarming. So this is also that same time frame, but more. So March 1st, 2020 to February 28th, 2021. So I just want to note that this is before the Delta variant is predominant. And we calculate things called odds ratio, which is the likelihood of something happening. So what's the likelihood of a preterm delivery if you get COVID-19 vaccination? So it depends on when, but there's a likelihood that's 9-fold increase of having a preterm delivery before 28 weeks. This is what we call extreme prematurity. And if we say prematurity 28 to 31 weeks, it's a 12-fold increase. If we say 32 to 36 weeks, which is preterm, it's a 23-fold increase. This is huge. This is really what we don't want to have happen, because babies born prematurely fare less well, not only initially, but sometimes forever. The odds ratio shown here of delivering on time, i.e. after 37 weeks, was fully 50% reduced if the mom got COVID-19 infection during pregnancy. That same odds ratio for ICU admission is almost 6. For needing mechanical ventilation, 14. So 14-fold increase. And the risk of death is small, but it's really markedly increased. A 15-fold increase in the risk of death if mom gets COVID-19 vaccination. So you may have seen these stories on the news. There's more and more, unfortunately, every day. But sometimes to save baby and to save mom, a C-section is done. Unfortunately, in this case, the C-section was done. The baby lived, but mom did not. So it is exactly the scenario that we are trying to prevent. And we hope we can engage you in getting vaccinated if you're pregnant, and if you are a practitioner, helping everyone understand the benefits of getting vaccinated when pregnant. So far, at least 139,000 pregnant women have been vaccinated, and there has been no excess adversity, no problems that have emerged that would be different than not getting vaccinated. And people have said, oh, I'm nervous, this might go into my DNA. This is actually not possible because it requires a certain enzyme that we don't have and the virus doesn't have. So some viruses carry this enzyme called reverse transcriptase, but the coronavirus does not, and I guess that's the good news. And we don't have it either. So we can't turn RNA into DNA, and it can't come into our own genetic code. So what about breastfeeding? This guidance was just recently updated, and another potential benefit is getting the vaccine during pregnancy is that you might pass the anti-COVID-19 antibodies to the baby. We don't know how important this is, but we think it couldn't be a harm, because that's typically what's happening when mom is vaccinated during pregnancy and when mom passes those antibodies along in her breast milk. So babies cannot be vaccinated, so we have to do something for them. And it's a diagram here showing a baby, and the baby's cells are blue, so that's a blue arrow, and then mom's cells are pink. And we know that cells, actually whole cells, pass back and forth between mom and baby, so antibodies can pass into baby as well. And it's this bidirectional sharing of the bloodstream that is so important for baby's growth, but also important for passive immunization. So lactation is a benefit. We know that there is more than just nutrition involved, and we know that if mom has antibodies against COVID-19, there is a proportional increase that is seen in breast milk. So offspring can be vaccinated by mom before, during, and even after pregnancy if mom breastfeeds. And this has led to new guidance from the CDC. This came out a week before the FDA made official the approval of the Pfizer mRNA vaccine. But what you can see here is that this was released August 11, 2021. And this was an analysis of registry data And in this registry data, they showed that there was no increase in miscarriage among women who got the mRNA vaccine before 20 weeks. And prior findings showed no safety concerns when vaccinated after 20 weeks. So this led to this guidance from the CDC on August 11th that COVID-19 vaccination is recommended for all people ages 12 and older, including people who are pregnant, breastfeeding, trying to get pregnant now, or might become pregnant in the future. Pregnant and recently pregnant people are more likely to get severely ill with COVID-19 compared to non-pregnant people, and getting a COVID-19 vaccine can protect you from severe illness. So what about men? We've gone through some of that. Men are partners and parents too. We need everybody in the house to get vaccinated. And I just found this last week. I thought this was sort of interesting. So it looks at birthday parties as a cause of COVID-19 transmission. And what you find is that there's more transmission when it's a milestone birthday party, like a big one that people don't want to skip. We get it. And everyone wants to get back to normal. So the way to get back to normal is to get vaccinated so that when you go to a birthday party and when you celebrate important family events, you're not giving COVID-19 to someone at that party, or you're not getting COVID-19 from someone at that party. Because remember, there's a silent phase to the infection where you can transmit and you don't have symptoms, and there is absolutely no way to test everybody every day. So we've got to use precautions. And the precautions that we were really strongly recommending is get vaccinated, wear a mask. We don't want to say don't go to the birthday party. We want to say get vaccinated. And then this study just came out. I think this is particularly important because children are going back to school. We want them to go back to school. And what you're seeing here is the size of the bubble tells you how much transmission there is. And this is the age of the child, so 0 to 12. And then this is the person who got COVID-19 from a child, their age. So this goes all the way up to 90. But what you can see is little kids giving mom and dad and mom and dad age people the infection. So you can think teachers, you can think nurses. Little kids need someone to help them. And it's sometimes their parents, it's sometimes their daycare provider, but they are perfectly capable of transmitting this virus. And there's a lot of transmission, as you can see here, and this is like older kids, so 10 to 17, lots of transmission to their parents, and probably similar age to the parents, teachers, and so forth. So the larger the bubble, the more the transmission, and you can see there's quite a lot of transmission that goes on. So kids are going back to school. Everybody needs to be vaccinated who can be vaccinated. So now Pfizer was approved for 16 and up. It's time to get everyone who can't get vaccinated. So this is just a quick take. COVID-19 vaccination saves lives, protects fertility, and safeguards fetal and infant health and our families. Okay, questions? To best protect baby, is it best to get vaccinated early on in pregnancy, or is vaccination in your third trimester just as effective? Well, whenever you get vaccinated, it's going to be effective. That's actually not what we're talking about. But you don't want to get COVID-19 infection in early pregnancy. In fact, that might lead to preterm delivery. And the earlier in pregnancy you get vaccinated, the better. But it's also true that the earlier in pregnancy you get COVID-19, you can't tell all of the consequences until later. So you might be putting yourself at risk for undue risk. The worst time to get a COVID-19 infection is actually in the third trimester. And so you don't want to wait to the third trimester to kind of swoop in and get vaccinated. You want to get vaccinated early so that you don't have to worry about the third trimester when really it's a high stakes game. So don't do that. Just get vaccinated as soon as you can get vaccinated. Will the hospital I'm delivering at provide the vaccination, or do I have to go through my OB office? So we are in the process now of trying to send vaccine to any office that wants it. And not every doctor's office is set up to do this now, but you can get vaccinated in the same places you could before, and you can continue to get vaccinated in your doctor's office if the doctor was vaccinating before. And we are trying to encourage more and more doctors to set up vaccination, but we can, you can just easily search if you have access to the internet and find out where to get vaccinated. We're not doing an active vaccination program postpartum. Like if you deliver, that's not when we think is exactly the right time, because now we're actually trying to get you out of the hospital with your baby and get all of that taken care of. So we would prefer that you come into the hospital vaccinated and then have that problem taken care of. I have COVID IgG antibodies and from a previous infection prior to pregnancy. Why do I need to get vaccinated? I read that levels of antibodies can't tell how immune you are to COVID. So why you need to get vaccinated is the immune education that comes from getting an infection is narrow, i.e. it doesn't work against all the variants. And what we think is that you get better immunity, like a wider portfolio or a broader range of antibodies when you get an mRNA vaccination. So it looks like, one, you'll get more protection, so you'll get an antibody boost, and two, you'll get a wider range of antibodies that will help with either the current Delta variant or hopefully not, but maybe another variant that might find its way up to us. What if you've had prior miscarriages? Is there any information on what the long-term effects are? Well, I mean, having miscarriages is a really distressing outcome, of course, and we all know that it's a sleeper in the sense that people don't quite appreciate how distressing that is. But getting COVID-19 will probably make that worse and make that more likely. So we really want you to get vaccinated. So whatever you have that is causing miscarriages, we don't want to add one more thing to that to make that more likely. So yeah, anybody who's suffering from infertility and recurrent miscarriage can get vaccinated, and then that will make everything better, not worse. Okay, it has been my pleasure to join you today, and thank you for listening, and I really appreciate your community support and doing everything you can for our community and for your families and for yourself. Thank you so much.